Now to our exclusive NBC 10 Health Check report tonight, and now a new non-invasive, non-surgical treatment for chronic pain. And folks from all over the country are coming here to Rhode Island for this treatment, which was developed in Italy. Here's NBC 10 Health Check reporter Barbara Moore Silva.
Well, again, good morning, Michelle. You see you're ready for your final treatment today.
Michelle Jacobson has traveled from Grand Rapids, Michigan to West Warwick, Rhode Island for a special medical treatment. It started with a breast cancer diagnosis 3 years ago for this mother of two. That led to reconstructive surgery that left her in severe chronic pain.
I couldn't walk out in a wind. I would cringe to put on clothes. I could not pick up my son.
5-year-old Micah, or hug her 8-year-old daughter, Severina.
When she first came to me, you couldn't do this. You couldn't do this. It killed her with pain.
It was Dr. Stephen D'Amato who brought this new pain therapy to Rhode Island, the first in the country to use it in private practice.
Being an ER doctor for over 30 years, I've seen a lot of pain and suffering.
So when he heard about the scrambler therapy, he went straight to the source.
Went to Italy, studied under Professor Marinello at the University of Rome.
That's the bioengineer who developed this new non-invasive, non-surgical pain treatment.
We tingling?
Yep, tingling there.
This machine is able to transmit down those cables every single combination of non-pain waveform string sequences.
It doesn't block the pain. It sends non-pain messages to your brain, in essence, training your brain to feel no pain. Carol Ann Donnelly, a 2-time breast cancer survivor who works for the Gloria Gemma Breast Cancer Foundation, had chemotherapy-induced neuropathy.
After the first treatment, I could actually feel, I have numbness in the tips of my fingers and had for many years, and the sensation was back. So it was like...
Were you surprised?
I was.
Robin Wiegand, a complicated case, chronic pain everywhere.
On a 0 to 10 scale, I always thought it was a 50 or a 90.
That bad.
It was horrible.
Robin, who travels from Las Vegas for treatments, is a believer, even if she doesn't completely understand how it works.
Every time it has gotten my pain down to 0.
And then there's 15-year-old cancer survivor Kendra Samaglia. She's now able to do this, stand on her tippy toes, no pain. Back to Michelle. She's now done with treatments.
You know, when he reaches up his little hands, like, pick me up. You know, and I can. It's just a miracle.
Dr. D'Amato says he's treated hundreds of patients like Michelle over the past few years. Overall, he says his treatment is about 80% effective in treating chronic pain. For more on this Calmar pain relief therapy, log on to turn10.com. Use the keyword health. And that's Health Check. Barbara Moore Silva, NBC 10 News.